autoclaving at 121 degrees Celsius, 15 psi, for 100 minutes ensures sterilization of surgical instruments, 15 minutes. The biological indicator used to monitor efficacy of steam autoclave contains spores of Geobacillus styrothermophilus. Dry heat sterilization, hot air oven, of glassware is performed at 160 degrees Celsius, 4 hours. 2 hours. Filter pore size that reliably removes most bacteria from fluids. Some micrometers, 0.22 micrometer. Ethylene oxide gas sterilization is preferred for heat labile items but requires adequate colon for residual gas removal, aeration, 12 hours or catalysis. Flash sterilization, 134 degrees Celsius, 3 minutes, is recommended for urgent processing in 100 cycles, pre-vacuum, dynamic air removal autoclave. Disinfectant concentration of sodium hypochlorite, available chlorine, for surface decontamination of blood spills, 100 ppm. 10,000 ppm, 1%. High-level disinfection of flexible endoscopes can be achieved with 2% for 20 minutes, glutaraldehyde. Alcohol-based hand rub should contain at least 60% ethanol or isopropanol for virucidal activity, 60%. Spalding classification categorizes medical devices as critical, semi-critical, and non-critical. IO Safety Cabinet Class 2 employs HEPA-filtered vertical laminar flow and percent recirculation, 70% approximately. Triple packaging system is mandatory for transport of Category infectious substances by air. Category A, UN 2814-2900. Universal precautions concept was first advocated by organization in 1985. Centers for Disease Control and Prevention, CDC. Sharps disposal. Needles should be destroyed by needle cutting and collected in puncture-proof container colored, white, translucent. In biomedical waste rules India, yellow bag is used for waste, infectious human, animal, anatomical, and soiled waste. Gram stain primary dye is crystal violet. Mordant used is grams iodine. Zeal-Nielsen staining uses acid fastness property due to mycolic acid in cell wall of mycobacteria, acid-fast bacilli. Catalase test differentiates Staphylococcus positive from Streptococcus negative by detecting release of gas. Oxygen bubbles. Oxidase reagent tetramethyl p-phenylenediamine turns, when oxidized, purple. Coagulase tube test for S. aureus must be incubated at 37 degrees Celsius and read up to 4 hours, and again at 24 if negative. Blood agar is an enriched medium, whereas McConkey agar is blank medium, selective and differential. Chocolate agar is prepared by heating blood to 80 degrees Celsius to release factor, NAD, V factor, and hematin, X factor. Selective medium for isolation of Vibrio cholerae with high pH is thiosulfate citrate bile salts, sucrose, TCBS. Buffered charcoal yeast extract agar is used for culture of fastidious intracellular pathogen, Legionella pneumophila. Cetramide agar inhibits most bacteria except Pseudomonas aeruginosa species by quaternary ammonium salt. Mueller-Hinton agar is the standard medium for testing by Kirby-Bauer method, antibiotic susceptibility, disc diffusion. Minimum inhibitory concentration, MIC, is defined as lowest antibiotic concentration that prevents growth, visible bacterial. Extended spectrum beta-lactamase detection uses phenotypic confirmatory test with clavulanic acid and antibiotic disc, cefotaxime or ceftazidime. carbapenemase production, KPC-NDM, in Enterobacterales is screened phenotypically by modified parentheses, carba-NP modified Hodge test. Cold chain for vaccine storage recommends +2 degrees Celsius to +8 degrees Celsius. Freezing should be avoided for 2 degrees Celsius. Adsorbed, DPT, hepatitis B, Hib, etc. DPT vaccine shake test determines accidental freezing by visible separation of blank floccules, adsorbent precipitate. BCG vaccine after reconstitution should be used within hours, 4 hours. Refrigerator log sheet temperature should be recorded at least 6 times per day. Twice. Rapid plasma reagin, RPR, is a non-treponemal test detecting antibodies against cardiolipin, lecithin antigen, cholesterol. HIV 4th generation ELISA detects P24 antigen and antibodies, shortening window period to roughly round days, 18 to 20 days. The malachite green content in Lowenstein-Jensen medium inhibits growth of B. bacteria, contaminating non-mycobacterial. Mycobacterium tuberculosis typically shows rough, buff, non-pigmented colonies on LJ medium after parentheses 3 to 4 weeks. Automated liquid culture system, MGIT 960, detects mycobacterial growth by fluorescence quenching of dissolved I2 oxygen. Cartridge-based NAAT approach rifampicin resistance by detecting mutations in the gene, RPOB. Sample rejection criteria: sputum specimens leaking or will not be processed. Exposed dried outside container or labeled incorrectly. Universal Transport Medium, UTM, is recommended for viral swabs because it contains antibiotics and, to stabilize virus, protein, fetal calf serum. Point-of-care rapid antigen test for SARS-CoV-2 detects protein of the virus, nucleocapsid N. CT value, cycle threshold, less than 25 in RT-PCR, indicates viral load high. Cold centrifuge is required for processing samples because they generate aerosols at room temperature, mycobacteria, blood cultures. Laminar flow in BSc Class 2 provides 100-fold protection to personnel compared to Class 1 by maintaining pressure zone negative. Needle prick injury prophylaxis for HBV non-immune individual is HBIG 0.06 milliliters per kilogram and vaccine at 0, 1, and length months, 6 months. Post-exposure HIV prophylaxis regimen, tenofovir plus lamivudine plus dolutegravir, must be started ideally within then hours, 2 hours up to 72 h. Infection control. Airborne isolation room requires minimum of air exchanges per hour, 12. Hand hygiene 5 moments concept was proposed by WHO, World Health Organization. Chlorhexidine has residual activity on skin because it binds just layer. Stratum corneum, keratin. Steam sterilization indicator strips change color based on chemical reaction at specific combination of speed, time, temperature, saturated steam. HEPA filter used in Operation Theater laminar airflow is capable of removing greater than 99.97% particles greater than 0.3 micrometer, 0.3 micrometer. Flash point of isopropyl alcohol is 11 degrees Celsius, hence large volumes should not be used near open flame/heat source. Pre-vaccination titer of anti-HBs, less than 10 MIU milliliter, after completing primary series defines non-responder. Sharp's injury surveillance rate is calculated per beds annually, 100 occupied. Spore strip containing Bacillus atrophius is used to validate blank sterilizer. Dry heat, hot air oven. MDR organism definition, non-susceptible to at least one agent in antimicrobial categories, 3 or more. Hand rub volume per application should be at least 5 ml to cover all surfaces, 3 to 5 ml. Fumigation of OT with 20 grams formaldehyde and potassium permanganate per cubic meter generates gas. Formalin vapors, formic aldehyde. Plasma sterilization, H2O2 gas plasma, operates at less than 50 degrees Celsius and is unsuitable for items with cellulose, paper, liquids. Indicator organism for pasteurization is Coxiella burnetii, resistant compared to Mycobacterium bovis. Colony count greater than 110 CFU per milliliter in midstream urine defines significant bacteriuria, except in gram-positive cocci, symptomatic cases, catheter sample. Automated blood culture bottles contain resin to neutralize antibiotics. Broad spectrum, example, beta-lactams. Time to positivity less than 12 hours in blood culture suggests high bacterial load, typical of sepsis, gram-negative. Speak, prosody rate 120%, matrix-assisted laser desorption ionization time of flight, MALDI-TOF, identifies bacteria by signature break time, 400 milliseconds, protein mass spectra, ribosomal proteins. Quinone cold acid fast stain differs from ZN by higher concentration of carbylfuchsin, phenol, no heating required. Safety level required for culture of Mycobacterium tuberculosis is BSL-CoNA. BSL-3. 3-bucket system, wash, disinfect, rinse, is recommended for decontaminating, instruments, endoscopes, reusable devices. Critical water in hemodialysis must have endotoxin level less than 0.25 EU per milliliter and bacterial count less than 100 CFU per milliliter. Vitek 2 AST panels provide MIC using principle of growth detection, turbidimetric, colorimetric. Beta-lactamase ANTC-inducible strains show blunting of ceftazidime zone next to whatever disc. Imipenem clavulanate inducer. D-test positivity indicates inducible clindamycin resistance in Staphylococcus due to S gene. ERM-A, ERM-C. Infection prevention bundle for central line includes maximally barrier precautions and chlorhexidine skin prep at bracket % concentration. 2% chlorhexidine in 70% alcohol. Ventilator-associated pneumonia bundle includes maintaining head of bed elevation at degrees 30 to 45. Residual chlorine in drinking water, as per BIS standard, should be at least 1 mg per liter after 30-minute contact, 0.5 mg per liter. McFarland's 0.5 turbidity standard corresponds to approximate bacterial density 100 CFU milliliter, 1.5 times 10 to the 8th. Reminder for repositioning peripheral IV cannulae every hours reduces phlebitis. 72 to 96 hours. Capsular swelling, quelling, reaction requires specific antibodies. Anticapsular, e.g., pneumococcal. ENH resistance in MTB commonly due to CAT-G gene, S315T mutation detected by line probe assay. Genotype MTBDR+. Water bath at 56 degrees Celsius is used for heat inactivation of serum. Complement in serum, for example, for serology. Frequency of biological indicator testing in hospital autoclave at least 1. Weekly, once a week. Pseudomonas grows at 42 degrees Celsius. This property differentiates it from Stenotrophomonas burkholderia. His serum sugar media are used for carbohydrate fermentation tests of Streptococcus species. Chloramphenicol susceptibility of Salmonella typhi is screened by zone diameter greater than 15 mm using disc strength prompt trank 30 prompt trank. Latex agglutination test for CSF directly detects capsular polysaccharide antigen of common meningitis pathogens like Streptococcus pneumoniae, Neisseria meningitidis, H. influenzae. Air sampling in operation theaters by settle plates exposes agar for a minute at waist height, 30 minutes. Pseudomonas aeruginosa produces fritty odor due to metabolic compound 2-aminoacidophenone. Quality control strain for extended spectrum beta-lactamase negative control in AST is E. coli, ATCC, etc. ATCC 25922. WHO 5-day treatment regimen DOTS for drug-susceptible TB is 2-HRZE/4HR, where H stands for H, isoniazid. Serological test Widal is considered basal titer positive if anti-O is greater than 1 to 80 in endemic India. Requirement: rising titer fourfold in 1 days, 7 to 10 days. Infection Control Committee meeting frequency at tertiary hospital should be at least quarterly, every 3 months. Fishy odor vaginal discharge with clue cells, positive whiff test indicates pH greater than 4.5. Chlamydia antigen detection from endocervical swabs employs DFA using fluorescein-labeled antibodies, monoclonal anti-MOMP. Candle jar 5%, 10% CO2 incubation is essential for isolating fastidious questions. Neisseria haemophilus. MiniVidas automated system uses alpha principle meaning enzyme-linked assay. Fluorescent, enzyme-linked, fluorescent assay. Gas pack jar generates anaerobiosis by catalytic conversion of O2 with palladium and blank gas, hydrogen. Contact time for alcohol-based hand rub until hands feel dry should be minimum ? Seconds. First syphilis serological test to turn positive in primary chancre is 1. TPHA FTA ABS, treponema. HQIP defines SSI, surgical site infection, as occurring within days of procedure, or 90 days if implant, 30 days. Hospital-acquired infection rate is expressed per 100 ... admissions/discharges, or patient days, depending metric.